I'm going to be moderating the next panel, so if we can have Nate, Kent, and Tami come up. I'll do a quick intro as they're walking up. Nate is the executive director at the CSU Prevention Research Center. Kent is the founding executive director of Rise Above Colorado. And Tami is the prevention collaborative and policy specialist at CDPHE, our state health department. Thank you all for being here. The mics should work today. I know they were working on them last night, so if we have trouble, we'll circulate another mic. But in the meantime, let's go ahead and start with Nate. First of all, can you just introduce yourself and tell us a little bit about the work that you're doing at CSU and why you think that prevention is important?
Yeah, absolutely. Do I need to push something?
No push.
Okay, I'm good. All right. Well, thanks, Heidi, for that question. And just want to say hi to everybody. I'm really excited to be here. I love to talk about prevention, and I'm looking forward to answering some questions today. And just want to communicate that, yes, prevention.
Oh, there it is.
There we go.
It is working. I think that table mic is working right now.
I was pushing it, and it wasn't.
Yeah, now it's working.
Okay.
Okay.
All right. I'm really excited to talk about prevention today. And I'm the executive director at the Prevention Research Center at Colorado State University, where, we do a lot of kind of federally funded prevention science research where we are testing new innovative ways of preventing substance misuse among children, adolescents, and emerging adulthood. But I think really more relevant to our conversation today is that the Prevention Research Center and CSU, more generally speaking, is a land-grant university, which means that we have a mission to directly reach out and engage with our community partners and our state agencies to do community-engaged research, or community-engaged research and implementation. So a lot of what the Prevention Research Center does is that we work with community partners and train and provide technical assistance on how to implement evidence-based prevention programs with fidelity, how to adapt those prevention programs when inevitably changes need to be made. So we provide technical assistance on best practices for adapting programs to be responsive to communities' own culture and history. And we also provide services like evaluation supports, because how do you know if your prevention programs are working if you're not evaluating them? And then we also work with communities on how best practices for sustainability of evidence-based programs as well, because the worst thing that we want to do is to drop a program or a practice into a community and then have it go away 2 years later after a grant ends. So that's what we do at the Prevention Research Center. And I really appreciate Heidi's question because I think it is a really important starting point, because we as a field of prevention are relatively new to this space of behavioral health. When I say relatively new, I mean the past 30 to 40 years, which isn't that long compared to treatment and recovery approaches to opioid use abatement. And so what we do in prevention science, I guess what that can do is it can lead to a maybe less of an understanding of what prevention is, what it can be, and how it can be used as an abatement strategy for opioid use. So what prevention does is that we take advantage of the past 50 years of public health research, of epidemiological research, developmental science, neuroscience, and we take advantage of what that research has told us are the precursors, the predictors of opioid use disorder. So this research can tell us what are the factors that put individuals at risk for a future opioid use disorder. We call those risk factors. What are those factors that can protect or provide resilience, help families with resilience against a future opioid use disorder? We call those protective factors. And then we as a field have developed evidence-based programs. There are registries. Yesterday, the Blueprints registry was mentioned, of over 100 evidence-based programs, practices, and policies that we'll talk about today that can be implemented that target those risk and protective factors before an opioid use disorder emerges. So we're going to talk about what these programs, practices, and policies can be. I'm more situated in the program space, so I work with schools and communities on implementing programs that can be implemented in various community contexts, including schools and families. And one of the things that I'd like to advocate for today is that we need a paradigm shift in that opioid use prevention starts early in life, and it may not even look like drug use prevention. So what we can do is we can implement programs into schools, in kindergarten, first grade, where we are addressing substance use prevention. Now, are we talking to kindergartners and first graders about methamphetamine or opioids? Of course not. But what we are doing is we are promoting those skills that are going to be really important for those young people to carry with them throughout their lives, so that when they eventually are presented with an opportunity to use substances, that they have those skills to decline those offers in those situations. So what are those skills? They can be self-regulation, communication, decision-making skills, peer relationships, all of those kind of things. Okay, and then as youth start to get older, they then transition into junior high and high school. These programs start to look more like what you would think of as a substance use prevention program. So you start to talk about awareness and knowledge and skills that are needed for young people to not use substances. So schools are one context where prevention can be incredibly effective. Families as well. Some families just need more supports. Maybe they have more risk factors in their community. Maybe they have more fewer protective factors in their community. And so families can be supported, again, with evidence-based programs. It's really important that we're using programs that we know work, okay, if implemented well. So that's one strategy, one prevention strategy, kind of this programmatic approach. There are other approaches that Kent's going to talk about today. He's going to talk about awareness campaigns, and then Tami's going to talk about community coalitions as strategies, prevention strategies that we know are effective. Now, why is prevention important? Well, what we're all going to be talking about today, as a whole, collectively, is the only behavioral approach that we can take that can prevent the incidence of new substance use disorders. All right? So prevention is a necessary approach to a comprehensive approach to opioid abatement, along with our treatment and recovery services as well. So what we can do is we know that, why is this all important? One is that because we can decrease the incidence of new opioid use cases, we can prevent a lot of the human toll that opioid use disorder has in our communities. All right? We can also, because these programs are incredibly cost effective, and I hope we have time to talk about cost effectiveness a little bit later. If not, ask me. These programs are incredibly cost effective. We can also prevent the financial toll that opioid use can have on our communities. Are we going to be able to prevent every case of substance use, of opioid use disorder? No, but what we can do, and this is another reason why prevention is important, is we can decrease the burden on our treatment and recovery professionals, because those folks are overwhelmed with the demand in the communities. They can't meet the demand, and prevention can reduce that demand for our treatment and recovery professionals. So prevention it's not something that's nice to have if you have the money. It is something that is necessary to have as a comprehensive approach that can complement treatment and recovery.
Thank you, Nate. Appreciate that. Tami is our prevention specialist with CDPHE, and you already have some prevention campaigns ready to go out the door or have gone out the door. Can you talk a little bit about that and how these folks can disseminate those in their regions?
Okay,
Yep,
good.
okay.
We're good.
Yep.
All right. So I know that Charlotte will be presenting later today, and she will be. Are you talking about Forward Together later? Okay. So CDPHE and the BHA came together and blended and braided their funding to create a campaign called Forward Together. And what we know from the Healthy Kids Colorado survey is that when young people feel connected to one adult, that they are less likely to use substances. So this campaign really dives into that and helps to support young people in feeling connected. There's also LGBTQ informed as well as colored communities involved in creation of this. So you can go to forwardtogetherco.org and resources, and if you have any additional questions, you can click the contact button to get a hold of Sarah DeLong, is the person at the state who is managing that campaign right now at CDPHE.
Thank you very much. And Kent, I think you have some slides, is that correct?
I do.
All right, here you go. I'll give you the clicker. And Kent has been working in this space for quite some time, and Rise Above is formerly the Meth Project, correct? And so a lot of us are familiar with that. But we're excited to hear a little bit more about how you guys are educating kids and kind of going about it from a positive perspective.
Sure, thanks for having me. And yeah, just to illustrate some of the things that Nate was emphasizing and what it looks like at a big picture level, and tell you a little bit about us as Rise Above Colorado at a statewide. We're a statewide prevention organization focused on youth 12 to 17, so middle school, high school aged. And really the goal is, as our tagline states with this I Rise Above concept, is empowering youth to make healthy connections, decisions, and change. And Tami referenced the importance of those connections and how that reduces use over time. And so actually I put this mural up here. If you drive south on your way out of town today, down Broadway, and when you hit I-25, look to your left, and that mural is our 50th mural. Community-based art happens to be one of the ways that we do our work in connecting communities, youth and adults, to be part of positive activities in those communities. And so that's part of our emphasis. So we really try to blend thinking about prevention at a statewide level and providing and connecting with partners at a local level. So I just highlighting a couple of things that are an overview of what our organization does. So positive social norming is one of the campaigns that we have been doing across the state for about 5 years or so. And this is the notion, it's an evidence-based approach around prevention that really recognizes the fact that most youth aren't using drugs and alcohol, whatever the substance is. Too often, I think we, particularly as adults, focus on the negative and how many are using. And this Positive Social Norms campaign is not meant to stigmatize the young people that are using or to minimize the impact of the numbers that are using substances or have a substance use disorder. However, what we want to try to promote is this positive norm, the fact that whatever that number is, it's the vast majority. In some cases, we're talking about 85, 90% of youth are not regularly using, whether it's alcohol, marijuana, vaping products, and other more dangerous substances as well. And so we want to promote these positive norms. And the idea is if we can change misperceptions around use and debunk that notion that everybody's doing it, we have a better chance if we bring those more in line and people realize, oh, my peers really aren't using, I don't need to do that to fit in. We're going to have impact over time. And we're starting to see that gap close actually around the state. So that's one of the things that we're doing at a statewide level through social media. So we're reaching youth where they're at, but we're also working heavily with community partners. And so we partner with probably about 24 different counties around the state. I know my Prowers County friends are here today. And so we have worked with a number of different community partners, and that could be a Boys and Girls Club, it could be a local public health institution, could be other nonprofits, to really get into communities and provide some resources, technical assistance, and support to take some of these things that might be at a statewide level, a campaign, and be able to work at a local level on those. We also have some resources for schools and communities. We specifically, I think appropriate to today's conversation, we developed a curriculum, a single day lesson I should call it, called Not Prescribed, that really talks about the misuse of prescription drugs. And now we're really beginning to layer on that information about fentanyl and contaminated pills so that we can stay up to date as much as we can and really raise awareness about the risks that exists with overdose and addiction as well, but really talking about where that starts from the prescription drug misuse typically. So that's one of the resources that we have available. as well. And so also, we're really working, as I said, with communities at a pretty broad level. We have some substance use data. Tami referenced a little bit of the Healthy Kids Colorado data. We also do a biennial survey, some data that will be out in the next few weeks for 2022, looking at use and attitudes trends with young people. So that as a reference point for all of us, both at a statewide level and local sort of community and regional data. And then we also try to engage youth throughout this process. I think one of the critical pieces is that we're involving youth at all steps of this process, advising our team. We have 2 youth partners that work on staff with us. We have a statewide and a Denver-based Teen Action Council that we engage with to help really drive messages home and take some of these resources back to their home communities. So hopefully we can continue to spread that word directly peer-to-peer through youth. So I'll leave it there for now.
Thank you, Kent. Tami, stigma is still a big problem in the mental health and substance use space. Is there anything we can do as either regional council members or the state to kind of dispel that myth and start talking more about this as a disease rather than, a choice that people make?
Can I pass this to Kent to answer? I think
of course.
And we'll have the Lift the Label anti-stigma campaign
So-
next session too.
Okay, so lift the label. Sorry about that. I didn't mean to steal your thunder, but but Kent, go ahead and answer. What you all are doing with that, and then I'll ask Tami a different question.
Sorry, specific to the statewide.
To stigma and what can we do as communities? And if you want, we can pass and wait till.
I will leave a lot of that to Charlotte
Okay.
because I think that's really her best expertise. But just to say, again, when we think about stigma, this is an ongoing process and changing that mentality over time. And again, I talked about that balance of how do we make sure that we're supporting those youth that need the help and folks that need the help while emphasizing that most youth aren't using.
Great, thanks. And then maybe for Kent and Tami, I'll ask you this question, and then I'll end with Nate because I have the $1 million question for Nate. So how are you working, whether as Rise Above or the state, to provide awareness to underserved communities? So specifically, you talked a little bit about underrepresented communities like communities of color, rural areas, LGBTQ communities. What can we do as we're rolling out our campaigns to, be more effective with those communities?
I think I would also like to just say something really quickly, if you don't mind, about comprehensive prevention. So when we're talking about prevention, there's a million different strategies that you can pick from, and it may even feel overwhelming because there are just so many choices of things that you could do. I want to put in a plug for making sure that what you're doing is evidence-based or evidence-informed, because you can actually do harm in a community by just doing what you think might work versus what the science says, which is what Nate was alluding to, all of the many, many years of science that is behind all of that. But within your communities, how many of you have coalitions that you're aware of within your communities? Okay, so a fair amount. That is one really good way to get your local expertise to address prevention issues, and within specifically the Communities That Care model, which is something that the state supports. It's about $10 million from the marijuana tax revenue. There are many probably in this room CTC coalitions that are functioning, but they are tasked with ensuring that equity is a part of the entire conversation. So who needs to be at the table? Who needs to be involved within the coalition to be able to have their lived experience represented, that there's folks who are actually living in your community or are a part of the decisions that are being made. So that is how I would suggest and recommend to all of you to really support and lean into your local coalitions, to look at their data, to know what it is that your community specifically needs, and then to be able to really bring in those folks who need to be involved in the conversation because they really know how to do it. And just getting behind, and that is something that all of you can do really easily. Just use your influence and your voice and stand behind your coalitions. So I know I got a little off topic, but that is really the center of equity, I feel like, within communities. If you really want your community to be uplifting and supporting those folks with mental health and substance use issues who are outliners, that's the way to do it.
I think that was right on topic, so thank you. Kent, did you have anything to add to that?
No, other than just to say, I think the importance of those community-based coalitions. If you leave with nothing else today, I think thinking about prevention being a part of this equation for you, whatever that looks like, and coalitions and organized folks in that community to really continue to focus on this with you and look for the opportunities that exist to, whether it's through really small programs that can have major impact on a number of families, and Nate could talk about that from a programmatic perspective of some of the evidence-based programs that really can have strong impact there. We are looking at some of those things to do in communities as we continue on, looking at how do we engage youth and provide leadership opportunities for youth, particularly that are not getting some of those opportunities in communities often, either whether they can't afford it or they don't have access to it. And so making sure that we're finding ways to partner with those local communities to provide those opportunities.
Thank you. And I think I mentioned this yesterday, but we're putting together an RFP right now that will go out hopefully soon to hire someone to help us with the prevention awareness campaign around opioids and fentanyl. And that is going to be expensive, right? And I'm skeptical of, campaigns. I think most of us are, because a lot of them have not been done well, or they've been done well, but then they weren't disseminated right. So Nate, on that note, how would you explain that prevention is a good investment, whether if you have a lot of dollars or limited dollars? What is the reasoning for that?
That's a great question. I have 3 points there. The first point, just point blank, it is way cheaper to prevent someone from developing a substance use disorder than it is to treat someone and have someone go through recovery for a substance use disorder. So that's that. Now, in addition to that, one of the interesting things about prevention is we've had a bit of a PR issue in that if we're doing our job, if we're doing our best, nothing happens, right? So nobody develops a substance use disorder. So we recognized that as a field early on, and we thought, okay, you hear these really powerful stories of people who have gone through a treatment and recovery, and they're doing really well. We've heard about a lot of those stories yesterday. We're going to hear about more of them today. With prevention, we have to rely on the cold, hard economic numbers to make our case as a worthy endeavor. And so we've done that. 10 years ago, a lot of these cost-benefit analyses were conducted and published in academic papers that nobody reads. But they have shown very, very beneficial effects in financial terms and in human terms compared to their costs. More recently, people in our field have published cost-benefit analyses that are available for the public and more easily consumed by the public. So the Washington State Institute of Public Policy, they have a cost-benefit analysis. You can Google Washington State Institute of Public Policy cost-benefit analysis. They've done a cost-benefit analysis on, I think it's 12 domains of behavioral health, including substance use, and they've looked at prevention and early treatment. And prevention is incredibly cost-effective. For every dollar prevention is spent on prevention, there are programs that give back over $1,000 in benefit. Okay, so go to that website if you're interested. That's not a perfect website in that it takes into account the Washington state tax structure and not Colorado. It very much underestimates the benefits and overestimates the costs, and they're very transparent about that because they want to be really conservative. So I think it'd be kind of cool if we did something like that in Colorado and had Colorado tax structure so that we could have this be even more relevant to Colorado communities so they can make their decisions on the most cost-effective programs for their communities. Third, so if you're intervening early, I talked about risk and protective factors. Now, a risk factor for substance use is also a risk factor for academic failure. It's also early in life. It's also a risk factor for risky sexual behavior. It's also a risk factor for conduct problems and violence, okay? So if we can intervene early, i.e. prevention, on these risk factors and protective factors that are related to multiple health behavior, downstream health behavior outcomes, we can have an effect not only on substance use, but also on all of these other problems that communities are struggling with. So that the cost benefit, the benefit of prevention is almost always underestimated because the research studies that programs are based on only are narrowly focused on the outcomes of interest and not on all of these other secondary effects that prevention can influence.
Thank you very much. All right, we're going to put a slide up in just a second that will give you some ideas for allowable uses around this part. But before we do that, any questions for our experts here? We have one clear back in the back. Stacy will get her steps in today. Stacy's our director of Safe to Tell, so if any of you are interested in Safe to Tell, she's the person you should talk to. Oh, we have a question on Zoom as well. Okay, we'll take this one here and then I'll get that one.
Good morning, and I love this panel. But my name is Kim Othie. I'm from Teller County. I'm the director of the DHS. And as you were speaking about prevention, have you guys considered the family resource networks in Colorado to put some of this stuff in? Because I would tell you, coming from the child welfare world, we did a cost analysis with our local one, and we proved that for every dollar spent in prevention, we save $3 in intervention. So that's just a really good network throughout the Colorado for nonprofits, and they are very versatile and they're getting stronger. So that's just a recommendation.
I think that's helpful too for the regional councils in the room to, kind of seek that out. Anything to add to that?
Only that I made a note to check into that.
Yeah, same.
Yeah, and we've partnered with them in Sterling as an example. So yeah, as one of those resource places for some of the programming, and a place to house some of that in a network is super important. Yep, thank you.
And we have a question on Zoom. Can you share if there are sustained prevention programming dollars available? So are there dollars that people can kind of count on, I think is the question, on an ongoing basis? I mean, definitely opioid settlement funds can be, a better sustainable model than, like grants that are only good for 2 years. And so I would again, so I'm not sure if they were asking this in the context of regional or state dollars, but I would say, talk to your regional councils, figure out if they have a plan for education, and if you're somebody who, is a vendor for that or knows more about prevention, I would talk to the regional councils. I imagine we'll have some money at the state and in the infrastructure fund that might be able to go to that as well. Oh, and Jose is going to answer that probably better than I just did.
This previous comment about the family resource centers, which are a network across the state, that's a really good reminder for the regional folks to look into them as a partner potentially for prevention. But the other group regionally, and I don't know if Nate or others can speak to this, but it's the extension offices. Is that extension offices across the state, especially in frontier rural communities, are a great place for some positive youth development programming. Extension has done great work in this arena, and they are operated out of CSU, but I think to make contact with your local extension to see, are there prevention efforts you're doing with young people that we could help support through the regional funds that you all have? Thanks,
Jose. And if you have questions about anything opioid related, Jose's a great resource as well. Any last questions? One more question. Oh, we'll do 2 more questions. I think we have time, and then we'll wrap this one up.
Thanks. I really appreciate your information as a former high school teacher. The talk about protective factors and then the other side of that coin, like ACEs or adverse childhood experiences. I'm curious if you have materials and things that the regional councils could use, if you're willing to come speak to regional councils about that, because I think it's really breaking it down into plain day language of like, why should I care? Whether it's our communities, and I know it sounds strange to say, why should I care, especially if you're a parent or whatnot, but it really comes down to that, like knowing what happens. It's, like compound interest, really, if we're turning, like return on investment, if we invest in early childhood education, which is much more than reading, writing, and arithmetic, it's all these things you're talking about. I think we'll see so many of the things that we're here today trying to solve for potentially reduced. I mean, we're looking at 18 years, and I would love to see that we're not building more treatment centers, actually, that the metric would be that we build less of those, or that at the end of that 18 years, we're transforming and reusing those treatment centers for something different as a result of addressing things when they're younger. So the question is, do you have materials? Are you willing to come speak? And the third question is, are you seeing yourselves invited to work with the the Behavioral Health Administration more now than before, so that it's informing what our state priorities might shape into over the next few years?
So yes. Yes, we do have materials that we can provide. I mean, we're again, CSU is the land grant university of the state, and we reach out and we engage with our communities in a number of ways, providing training, technical assistance, materials. We do speaking engagements and things like that. We have a whole team, a whole wing that's devoted to that. In terms of the BHA, we haven't been involved in that all that much. Where we have been more involved is with state agencies like CDPHE and Colorado Department of Education, where we're working with SAMHSA block grantees. So that's one source of somewhat sustained prevention dollars. At least it has been for the past 4 or 5 years, where we're working with CDPHE to develop kind of translational research to practice tools to work with communities on, we have this program, and how do we implement it as intended, and then how do we adapt it for our cultural, our local context. But that being said, we also even move back a step further and give those kind of awareness talks and provide the rationale and the argument for prevention and early prevention, because it is so important. So, and I don't know if I guess my contact information is somewhere, but wherever it is, please feel free to reach out to me and to us at the Prevention Center. We're more than happy to engage.
Great. Go ahead.
So add to that, we'd be happy to engage in those conversations. I think one of the things that we're going to be interested in continuing to work with Heidi's team, as she talked about and AG Weiser talked about the prevention campaign aimed at youth, particularly around the fentanyl issue, but that can be a broader focus, and we want to be partners in communities to figure out how do we take a statewide message and be able to work with it at a local level, and what are the activities and the support and the infrastructure that we can help support so that you can go further with that message in your communities, in your schools. So we'd be happy to participate in that.
And we did have one comment online. They say, I think it's tough to ask local regions to put money in prevention when there are so many deficits in harm reduction and treatment services. Would be great to see prevention dollars that are separate. So maybe something for us state partners to kind of think about as we move forward. Did we have one last question? Oh yeah, you had one question, Councilmember.
Would you mind addressing how you measure success? What are your metrics that you're using?
So I can talk about it from a programmatic lens. So evaluation is so important outside of the research context. So what we do is we work with communities, and we're hoping that I'm sure that their communities will vary in their capacity to be able to evaluate what's going on, the prevention activities that are going on in their community. But we recommend that your community, whoever's implementing these programs, are evaluating the effect of those programs on the intended outcomes. And any evidence-based program should have, with that program, evaluation measures, the way that they measure outcomes. And community partners can do that. And then we, as the Prevention Center, we can also work with communities on helping them interpret those findings and then turn those results into continuous program improvement as a kind of cyclical process.
Wonderful. Thanks for all the great questions, and thank you to our panel. We have these great experts here. Please grab them at the breaks and pick their brains some more.
Wonderful. Thank you, everyone, for listening and bringing your full selves here today. We know it's a long day, but such important topics around prevention. I just did want to bring up one note. It was around coalitions. If you don't know who your coalitions are in your community, please reach out to them. There's the Community That Cares coalitions, and they're all around the state. There's also Overdose Data to Action, which is another coalition around the state. There's also Drug-Free Communities coalitions that are around the state. And so these people have been doing this work for a long time. Make sure you've reached out to them. I used to be part of a coalition, and they are key folks you want to include. So we'll bring up our next speaker to talk about a really important campaign. The reason we want to talk so much about anti-stigma campaign, it's great that Heidi brought it up earlier, is we know a lot of regions are looking at spending their money on anti-stigma campaigns, and we just wanted you to be aware of what exists currently at the state. You may still decide that you want to spend your money on the anti-stigma campaign, but at least to know what exists at the state, because a lot of it is available for free or for very low cost. So there's a couple materials here, and she's going to be showing some a video at the end as well, but I'd love to bring up Charlotte from the Colorado Department of Public Health and Environment. Charlotte is the Deputy Communications Director for Colorado's Behavioral Health Administration. The Behavioral Health Administration started on July 1st. New acronyms, we're all making it difficult, right? BHA is one of those. But they're leading Charlotte's leading the campaign strategy for all awareness and behavior change campaigns, including the Lift the Label. So we're really grateful to have Charlotte here today and to talk about this campaign that I think has been in existence for 4 years now. Is that right? Great. Well, I'll pass it over to you.
Thank you. I'm like being so gentle with this. Does it slide in?
Just want to make sure you don't get close to it.
Okay, you're forceful. I did not want to mess with your mic like that. So I am Charlotte, Deputy Communications Director, fancy title. I prefer to go by Director of Hype, King of Campaigns, any of those work. So I'm really excited to talk about Lift the Label with y'all and how we can partner. Oh, sorry, that didn't translate. So Lift the Label is Colorado's anti-stigma campaign. Again, has been in market for 4 years. To date, we've amassed over 500 million impressions. We've been highlighted in the American Journal of Public Health as a model campaign for reducing stigma around substance use disorders, treatment and recovery. We have over 50 Coloradans sharing their story, either as a person in recovery, a loved one, or the people in our community that are there to help folks who are seeking treatment and recovery. So up here you see Corinthia, Mike, and Rika. They are all real Coloradans who shared their story as part of the campaign. So why do we focus on stigma? We have really great data here in Colorado from the Colorado Health Institute that says that a little over 80,000 Coloradans did not seek help for a substance use disorder that they knew they had because of stigma, and that's huge. So it's better than years past. We see it getting better every year, but it's still a significant problem, and that's why we focus on stigma as a campaign and as a state agency trying to reduce that, because we know that fear of judgment and shame is what's keeping people often from seeking treatment in Colorado. I think probably what's next is a video that I'd love to share. It is one of our brand new videos we just released a few weeks ago. One of the big audiences we really want to focus on reaching are professionals. So again, medical, behavioral health, and law enforcement professionals. We know that there's a lot of stigma to be reduced in those populations, and that's been one of the new audiences that we're focusing on with Lift the Label. So I'll go to my AV crew to tee that up.
For opioid use disorder needs to include medication for the vast majority of people.
There are medications now out there that are proven to help people get off opioids.
The beautiful thing about medication is it takes away the withdrawal symptoms, the cravings, the urges, the sickness.
We can let the medication continue to be helpful while we do the other work of building that person's life.
There's this idea that we're trading one addiction for another. That is simply not true.
Today, a lot of people don't believe that substance use is a disease.
Addiction and the impact of addiction is not a choice. No one chooses that life.
For all other medical concerns, we have treatments and we use them. It's really about breaking through the stigma.
If we're into serving the public and saving lives, isn't this part of that?
I'm sure you noticed a lot of folks that we've already seen speak at this conference. You'll see a few more later. They're a lot of the greatest hits in Colorado when it comes to supporting folks in recovery, and those are the people that are there to help the folks that we are all aiming to serve through the opioid settlement funds and through all the work that we do in and out of that funding. So those are the kinds of ads that people see when Lift Label runs ads in market. So those ads are going to be targeted to those professionals. Again, we tell those stories of recovery to loved ones and people in recovery. Really, the whole point is to connect people to treatment. So, again, this is an example of one of the ads we run. This would have a swipe up function, and it would take somebody to our Get Help page. And this is how we connect people to treatment. So again, yesterday folks were talking about OwnPath. That is one of the big treatment locators that Lift the Label is going to be driving traffic towards going forward, so people can see exactly where to get help near them using that location function. A big part of Lift the Label's Recovery Cards project, I brought a few to show. Whoever the lucky person is at the end of checking these out gets to keep them. Just kidding, you can order them online. We'll go over that. But check them out. Don't be afraid to keep them. So Recovery Cards project came about because one of the folks in our campaign, Susan, told a story that's the most illustrative example of the gap we kept hearing about, which is people don't know what to say to me when I tell them I'm in recovery. People don't know what to say to me when I tell them my son overdosed and passed away. Susan had described a story where in her community, somebody had cancer. The community rallied together and brought meals and drove people to, appointments to do stuff and things. But when her son passed away from an overdose, nobody knew what to say. Casseroles didn't show up on the doorstep. Nobody stopped to talk to her. And simply because they didn't have the words, she didn't get support. So this is where Recovery Cards Project came in. We asked people in recovery, what do you wish somebody had said to you in that moment? Or what did somebody say to you in that moment when you most needed to hear words of support? We took those messages, we worked with artists, and we created cards to share those really hopeful, inspiring words of encouragement. One example you see here is The Phoenix, done by Mila Long, a person in recovery right here in Colorado. I believe she's speaking at some point later today. She's amazing. And so on the inside of this card, it says, outside the, oh shoot, I'm gonna mess it up because I'm in front of people, and that's naturally when you mess it up. Out of the darkest places, the brightest things can be reborn. You've got what it takes. I'm pretty close. And so that has been the #1 card since we launched in September of 2019. When we launched, we had 10 cards. We're up to over 50 now, and that remains #1. The Phoenix is, again, huge symbol in the recovery community. Those words are very simple but say a lot. It's been a really moving project. When I show these cards at tables, at least one, if not a bazillion people will walk up and have a very emotional reaction, because again, it's those words of support that they really need and want to hear. So we've sent over 70,000 cards since September 2019 all across Colorado. If you go on our website, you can see this traveling display I mentioned here in the last bullet. I call her Card EP. Just a really large display for all of the cards. We have tabletop kits that are available to order. That comes stocked with 250 cards. And you can always order online, Colorado residents only, because it's just for us, we're special. And you can order up to 10 cards, I believe. It's very rad. It's hard to pick 10 when there's 50 that you're going to really like. So again, if you're the person who picks up the card at the end, you can get the ones you didn't get today. So how can you work with Lift the Label? Bringing Lift the Label to your community, incredibly easy. There's 1,000 options. If you have budget, fantastic. If not, cool. However you want to get involved is totally up to you. You can promote Lift the Label in your community by going to liftthelabel.org/about. We have a social media toolkit. Easy copy-paste posting to share those really powerful videos and messages. Also at that link, you have free materials that you can order. Now there's an order limit on those, so there's some folks in this room where I know there's a huge demand. We've worked together to try and get past those order limits, but there's only so much I can do across the state. So one of the options is for y'all to purchase those materials in bulk so you can get them out there and make sure you have what you need without my very restrictive order limits. You can also request a free Recovery Cards Project tabletop kit. Again, for free, very beautiful little display. It comes with 250 cards at that bit.ly link. It's worth it because we have built brand awareness and brand equity across the last 4 years of being in market. We're a statewide campaign. It is very likely that folks in your community have already seen the ads, so anything you put out there in addition to it is just gaining more trust and building connection with the community around seeing this before, recognizing it, and hopefully utilizing it as a resource to find treatment. No need to start from scratch if you're thinking about developing your own. It's very challenging. We have a ton of research-backed materials. We're very excited to share them, happy to share them, again, free. We also have access to legit script designation, which is really important for the paid advertising piece. So if anybody was interested in scaling up, lift the label in their community, that's also a really important thing that we're able to have access to. So cost, again, if you want to scale up, print materials are available, purchasing recovery cards in bulk are available. There's my contact because I am out of time and I also want to break just as much as you do.
Awesome. Thank you so much, Charlotte. The materials are in the front of the registration, and also the Recovery Cards Project is in room 1E. Grab as many cards as you want. We've got an authority. We are at a 6-minute break, so it's